Hello, everyone. My name is Marlene Martin, and I am Professor of Clinical Medicine at the University of California, San Francisco. My clinical work is based at San Francisco General Hospital, where I am the founding director of the Addiction Care Team, ACT. ACT is an interprofessional consult service that provides evidence-based treatment and linkage to care to emergency department and hospitalized patients with substance use disorders. I also work in our Bridge Clinic where I see people with substance use disorders in the outpatient setting. Today, I am talking about reducing harms for alcohol use. I hope you can integrate these strategies into your practice and patient education. Why reduce the risk of alcohol use? Approaches to reduce the harms of alcohol use meet patients where they are on the spectrum of their alcohol use. They reduce the risk of drinking and promote health and compassionate care. As a doctor, they provide me with a set of tools and options for patients who may not seek complete abstinence. They also give patients a place to start making a change. Beyond this, they center patient autonomy and let them direct their care. It starts with a conversation. When I care for patients with at-risk alcohol use or alcohol use disorder, I use motivational interviewing to inquire about the role of alcohol in their lives, what they like about alcohol, and what they do not like. Just like with other substance use disorders, I ask about their goals related to their alcohol use. When patients share that they would like to reduce their use, improve their health, or are unsure of what they would like to do, I explore strategies to reduce the harms of alcohol use with them. The emergency department, hospital, and outpatient settings all provide opportunities to discuss a person's goals for alcohol use. And if you're having a conversation with a patient about their alcohol use, they may be open to thinking about a change. We can approach strategies to reduce the harms of alcohol use by asking people who are interested in reducing their use or improving their health about ways they can identify doing so. Patients often brainstorm ideas and tactics that may work best for them and their lives and are feasible for them to implement. For those unsure of where to start, we can offer a menu of options tailored to their drinking patterns and personal goals. I think of tactics for reducing the risk of alcohol use in three main categories. 1, staying healthier, 2, reducing use, and 3, staying safer. Now let's get into each of these categories. First, in terms of staying healthier, we have a few options. Drink a glass of water between drinks. This keeps people hydrated, may reduce hangovers, and reduce overall alcohol use. This also gives people time to feel the effects of the drinks they have already consumed. Eat before and while drinking. This helps absorb alcohol more slowly so that a person feels the effects of alcohol in their body more gradually and may help people space out their drinks. People with alcohol use disorder may also be at risk of nutrient deficiencies as they replace food calories with alcohol. Alcohol can also damage the gastrointestinal lining and lead to impaired absorption of vitamins. That is why it is important to eat a balanced diet rich in vitamins, including thiamine, which is found in foods like whole grains, beans, nuts, pork, and fortified cereals. Second, to reduce use, people can alternate beverages without alcohol in between drinks, which is also a technique we just discussed to stay healthier. Choose beverages with lower alcohol content. For example, drinking beer or wine instead of liquor and avoiding shots. Add ice or dilute drinks. Plan alcohol-free days is not at risk for alcohol withdrawal. People can work with their primary care clinician to do so. Set drinking limits in advance. For example, no more than 1 drink every 2 hours at a party. Count and track drinks and goals. This can be done through a phone application, workbook, or journal. For example, while drinking, count bottle caps or cocktail napkins to track how many drinks are consumed. Third, to be safer, avoid drinking alone. Assign a buddy to help track drinks. Do not drive when drinking. Leave keys at home, assign a designated driver, or arrange safe transportation. Don't mix alcohol with other substances. There are other ways to engage in reducing harms and improving health related to alcohol use. Asking patients about how alcohol use is affecting their health opens up an avenue to discuss atrial fibrillation, liver disease, gastritis, or high blood pressure, and may lead someone to consider reducing their use. Medications for alcohol use disorder are also an evidence based way to help patients reduce their alcohol use. For example, naltrexone, a mu opioid receptor antagonist, can help patients whose goal is to abstain from or reduce alcohol use. Other medications such as acamprosate, gabapentin, disulfiram, and topiramate may also help people abstain from or reduce their alcohol use. You'd be surprised how many patients don't know these medications exist. PCSS-MAUD offers a variety of trainings and education on medications for alcohol use disorder, so please be sure to check these out for more information. There are also public health approaches to reduce the harms of alcohol use. For example, sobering centers provide spaces for people with active alcohol intoxication to rest, hydrate, and eat while avoiding other locations, such as emergency departments, unless they are in alcohol withdrawal. Managed alcohol programs offer alcohol and supportive housing and help prevent withdrawal and reduce harms, while overall reducing alcohol use and improving health. These approaches meet people with alcohol use disorder where they are evidence based, and provide compassionate, practical care for patients. Having these conversations with your patients lets them know you care and are invested in their goals and well being.